Hello and welcome to a high-level overview of the Medicaid Insurance for Workers with Disabilities, or the MIWD program, and the changes coming October 1st, 2021. First, we'll go over through an overview of the MIWD program. The Medicaid Insurance for Workers with Disabilities program, or the MIWD program, allows individuals with disabilities who would otherwise be eligible for Medicaid, except for income due to them being able to work. They will then qualify for and receive medical coverage. Legislation was passed in 2020 making changes to the MIWD program. These changes include two new eligibility groups, which are called the Basic Coverage Group and the Medical Improvement Group, and they also modified standards for eligibility, lower premium caps, and all of these changes will go into effect come October 1st, 2021. One thing to keep in mind about the MIWD program is that there is not a separate application to be considered. Individuals interested in the MIWD program or feel they might qualify submits a general Medicaid application, and then DHHS takes that application, screens them through all the other programs in Medicaid, including the MIWD program. Breaking down the two new eligibility groups, within the basic coverage group, individuals need an income between 101 and 250% of the federal poverty level. Resources are at or below $4,000 for an individual or $6,000 for a couple. Be at least 16 years of age but less than 65. Have earned income, which includes self employment, and they meet the Social Security Administration disability criteria. Now, this disability criteria can be different depending on circumstances, which include if individuals are currently receiving Social Security disability insurance, this meets the disability criteria. But if they are not currently receiving Social Security disability insurance, the DHHS state review team will then determine disability eligibility based on their Medicaid application. Talking about the medical improved group, the criteria for this is all of the eligibility requirements within the basic coverage group, but also defines employment as earning federal minimum wage and be employed more than 40 hours per month. The participant must have been enrolled under the basic coverage group previously, but then lost coverage due to a medically improved disability. The participant no longer meets the Social Security Administration disability criteria due to this medically improved disability, and we will break down what a medically improved disability is right now. So, a medically improved disability is defined as a medically determinable severe impairment, which could be the individual's disability. The impairment continues to substantially limit one's ability to work or conduct daily life activities. The mental or physical health condition has been stabilized by assistive technology, medication, treatment, monitoring by medical professionals, or a combination of any of these factors, and the loss of medical services may result in a deterioration of the condition, making the individual unable to work or continue their daily life activities. So, the loss of this medical assistance could result in the participant's inability to continue in the workforce, or their health problems could regress to the point where they would meet Social Security Administration's definition of disabled. So, if they did meet the SSA definition of disabled previously, then due to medical improvement, they lost that definition. They would still be eligible for an MIWD because they might be working more or earning more income. They're still eligible for Medicaid coverage, even though their disability has improved due to medical improvements. Talking about the MIWD premiums coming October 1st, 2021, if a participant in either the basic coverage group or the medical improvement group, if they earn 200% or more of the federal poverty level, but less than 250%, a premium will be required. With the new legislation, this premium is capped at 7.5% of their income. It won't go above. A premium calculation chart has been created and is available effective October 1st, 2021. It is currently on the MIWD public website on Nebraska DHHS's site, which we will go over in just a couple of slides. But this premium calculation chart goes into effect on the 1st of October of this year and will be updated yearly. What can current MIWD participants expect with these changes coming this year? The most significant changes participants will see are to the income tests and the removal of the trial work period, or the TWP. Current participants will be reviewed for eligibility within the new program changes, and DHHS will notify any participants if any significant changes come their way. This notice will detail the status of their eligibility in the new program, such as change in state law and regulations, any change in eligibility group between the basic coverage group and the medically improved group, or any changes to the monthly premium if that is appropriate to that individual. Breaking down the share of cost. So current Medicaid recipients who have a share of cost but are not in the MIWD program will not be automatically considered and screened for eligibility within the new program. Individuals who are interested or feel they could be eligible for the MIWD program should contact their caseworker and reach out to DHHS for MIWD consideration in one of the new eligibility groups. This being said, individuals will also be reviewed at the time of their regular Medicaid case renewal to determine if they can transition to the MIWD program. But if individuals feel that they are eligible and are interested before this yearly renewal case review, they can contact DHHS and see about being screened for MIWD. Here's some informational materials that have been created and are available to the public by DHHS for the MIWD program. These include the frequently asked questions, MIWD fact sheet, that's a high-level overview, just like this presentation that goes through what current participants and future participants may need to know going forward with the MIWD program. There's a premium calculations chart, which goes into effect 10/1/2021 and will be updated yearly. And here is the URL to the public site through dhhsnebraska.gov. Other things of note that these are PDF files and materials are absolutely available free of charge. You can go, click on them, download them, save them, and distribute any way you see fit. There are Spanish translations available for the one-pager and FAQ if that is needed. Here are overall resources for DHHS. So if anyone is interested in being screened or applying for Medicaid and looking more into the MIWD program, please feel free to reach out online, by email, by phone, by fax, and by mail, or to your DHHS caseworker if you are a current Medicaid participant. And that brings us to the end of our high-level overview presentation of the MIWD program and the program changes coming October 1, 2021. If there are any questions after this presentation, feel free to email the Medicaid and Long-Term Care Communications team at this email address shown. We will take your question and get some expert advice or answer your question as soon and effectively as possible. In the meantime, feel free to send an email out. And I appreciate your time and thank you so much. I hope you have a great day.